Good evening. My name is Keith Ann Widener, and I'm a nursing student at the University of Charleston. And I'm glad to be here this evening, and I wanted to spend a few minutes with you to share some information with you and to do a little demonstration for you. How many of you have been diagnosed with hypertension? Yeah, a lot of people have hypertension. Well, the holiday season is quickly approaching us, and it's one of those times when we deviate from our diets a little bit and usually wind up with elevated blood pressure. Well, as I said, I'm a nursing student, and one of the most important jobs in nursing is to educate patients on health maintenance and prevention. And so to become more familiar with the causes and effects of hypertension, I would like to talk about a few things. Number one, who is at risk? Well, anyone can have hypertension at any time, but it is most common in adults. Up until the age of 64, it is most common in men. Then after the age of 65, it's just as common in women as it is in men. People with an overweight or an obese body habitus are at greater risk. Those who eat a lot of salt and sodium will be at more risk. And it can be hereditary, which in my family that is the case. It runs quite prevalently in my family. Those with chronic diseases such as chronic kidney disease can be susceptible to hypertension as well. How is it diagnosed? Usually your doctor will do a blood pressure check with a meter and an inflatable cuff. The top number, which is the systolic pressure, becomes more important after the age of 50. Up until then, the bottom number is the one that's the most important. Treatments for hypertension are low sodium diet, exercise, oral antihypertensives, or diuretics are some of the things that are used to treat it. For blood pressure maintenance, daily blood pressure checks, watching your diet, compliance with your medication regimen, and regular checkups with your doctor. And all of these things help keep your blood pressure under control and help keep you from being susceptible to other complications, such as a heart attack or a stroke. Okay, the next thing is how to use the blood pressure meter. Does somebody want to be my guinea pig? And it reads in millimeters of mercury, I think is what it is. Read this through your sleeve.
Yeah, they do. Doctor's office.
All right, you just take your cuff and make sure that you have the right size cuff. And they come in small ones for kids, and they have the patient turn their arm with the inside of the elbow facing up. Your meter should be, you see where the arrows are, should be right on top where you can see it, and the arrow should be pointing to the middle of the arm. You take your stethoscope, always make sure that your valve is closed. You inflate your cuff until, let's see, is this? I usually take it around until it's right about 200. And then you place your stethoscope right where the arrows are, and you slowly release the pressure. And when it gets to where you hear your first heartbeat, I'm not able to hear his heartbeat real well through his shirt, but the first heartbeat that you hear is the systolic pressure. And you let the air slowly release from the cuff until the heartbeat stops. And where the heartbeat stops is the bottom number, that's your diastolic pressure. And they make many different kinds of monitors. There's some that you can put around your wrist. And my mom uses one of those to check her blood pressure every day. And one of the things that she does is she takes her blood pressure every day, especially in the morning. And then she records it and then she takes it to the doctor with her so he knows what her blood pressure is every day. That way they can discern whether your blood pressure is due to stress, whether it's due to anxiety, or whether it is actually hypertension, because all those things can elevate your blood pressure. It's an easy thing to monitor, an easy thing to treat, an easy thing to maintain if you just work at it. Not doing so can be life-threatening. You can have a stroke or a heart attack, and it can cause damage, to other parts of your body. So it's keep a good check on it. Don't cheat too much during the holidays, and take good care of yourself.